New at 11, when COVID-19 hit, millions of Americans put off those annual checkups. That's care that's often critical in identifying conditions before they become critical. Our Rachel Krause introduces us to one woman whose trip back to the doctor helped save her life.
Inside Saxony Hospital,
halfway to the finish line. The gals here in rehab make it fun.
Kathy Lockhart gets to work.
Give it your all, but don't take it past about what feels moderate.
Okay.
Cardiac rehab, now a part of her routine, putting her health first.
We only have one ticker, we got to take care of it.
But it wasn't always a top priority. Before this June, she hadn't had a physical since 2019, the pandemic keeping her and millions of Americans out of those healthcare routines.
Just put my healthcare on the back burner, which wasn't a good idea.
A study out of Harvard found 1 in 5 people in the U.S. put off primary care due to COVID-19. Then something else entirely brought Kathy into her doctor's office over the summer.
On May 1st, my husband and I celebrated our 40th wedding anniversary, and he unexpectedly passed away on May 12th. So I went to the doctor on June 8th when I realized I was battling insomnia and depression.
After getting grief counseling and a prescription for an antidepressant, her physician's assistant got in that heart and lung checkup.
She took my blood pressure, listened to my heart, and slowly turned around and our eyes were locked on. She said, "Kathy, you have a loud heart murmur." So my first reaction was, not me. You better listen again. And I decided I better listen to her.
A traditional heartbeat they always teach us is that classic love dub. A murmur can sound like a swoosh.
Kelsey Miller, a physician's assistant at IU Health, says it's those annual physicals and routine exams that let them check on smaller concerns and identify problems early on before they become critical.
Every patient deserves that heart and lung exam, and that is the reason why, because we need to be able to catch these things, make sure we're not overlooking something that could drastically impact their health.
And for Kathy, life-saving.
So it might have been there before, but I had no symptoms, nothing. I had no shortness of breath. I didn't have any swelling, puffiness, anything like that. My first symptom could have been fatal.
But thanks to that checkup, she was able to get in for surgery, repairing her heart's leaky valve and making her way slowly down that road to recovery.
Well, I haven't always been this bright and sunny. I've had those days where it was really, really tough.
But she says with her friends, family, and especially her faith, she's found the strength to keep pushing forward, one step at a time, and with it, getting her heart and health back on track.
I'm very lucky that everything's gone the way it has.
In Indianapolis, Rachel Krause, 13 News.